Try not to ask anything too personal if you don't want it to be shared. But if you do, I will make sure to edit so that your information won't be shared with other people. I am Sierra Bazell, and I am the founder and executive director of Faithfully Fertile Foundation. We have attempted to help people that are dealing with infertility since 2019. We have been supporting people by offering scholarships and grants for them to be able to actually do fertility treatments. We have supported people that have gotten pregnant by offering them scholarships that have helped them to be able to have postpartum doulas. And we recently opened up a reproductive justice component where we are now trying to help people with birth doulas and lactation consultants as well, because we know that infertility can sort of cause issues in every area of your life. Sometimes it can cause problems with birth, and sometimes it can even bleed over into lactation as well. So we're trying to be a one-stop shop to help people. We offer a support group, and we also are looking at adding a component in where we're helping people with their mental health as well. So today we want to open up this space and have a conversation because Black people are dealing with infertility more than others. We are 2 times more likely to be infertile, and there are not enough people having conversations around this topic. There are not enough people actually taking it seriously. Because we hear myths all the time from people saying that Black people are super fertile and we don't deal with these issues. There's a lot of stigma surrounding being infertile. And we have people that are dealing with infertility from all walks of life, whether it is somebody that is single, somebody that is from the LGBTQIA plus community, or somebody that is in a heterosexual relationship. It doesn't matter because we're all dealing with the same thing, and nobody is trying to listen to the issues that we are having. You have medical professionals that will dismiss our concerns. A lot of them don't know how to deal with the things that we're dealing with. And so we want to open up this space because we have people on here that are mental health professionals. We have nurses, we have lactation consultants, we have health coaches, we have medical doctors, we have midwives. We want to be a space where we can open up the floor and just have a conversation about how we can help people in our community. So again, my name is Sierra. I dealt with secondary infertility for 7 years as a result of having a C-section after giving birth to my daughter. And I ended up losing my tubes because no one wanted to listen to me when I said that I was in pain. So if you have dealt with infertility, I want you to share if you feel like sharing. If you don't want to share, just give your name and kind of who you are and why you are a part of this discussion. I'll start with Mary.
Good evening, everyone. I am Mary Cato. I am a yoga instructor. I specialize in infertility and women's yoga and offering support through movement and healing. I am a trauma coach, and I am also a secondary infertility survivor. I experienced infertility. We're not really sure why. And so that is one of the aspects that I do support, that we don't always know why we're experiencing infertility. I have had 7 losses and I have had to work through that. And I try to be in the space to help others move through and work through their losses as well. And I am glad to be here to offer my support and my story, that it can help anyone and continue the conversation.
Thank you, Mary. All right, I'll have Ray go next.
Hey everybody, I am Ray. I am a nurse, a doula, breastfeeding specialist, and I feel like I have basically been in this space my whole life because I feel like I have been advocating for myself with reproductive stuff since I was in high school. And I suffered all throughout high school and college with painful periods, just the whole 9 yards. And I did not get a diagnosis until 2016, after changing providers. Maybe went through about 5 or 6 providers before I got somebody that would listen to me, do labs, do an ultrasound, all that stuff. And all at one time, I got diagnosed with PCOS, endometriosis, and an inverted uterus and infertility. So that was like 4 whammies back to back to back. And I was in a place where I could not afford IVF. It was not covered by insurance. So I had to take a holistic approach. And after 2 years, I did end up conceiving my son. And then after him, I had a loss, and I have not tried again since then. So a weird space to be in. But I just like to be in a space to encourage other people because I remember what it was like getting diagnosed and going online to the blogs and Instagram and not seeing people that look like me. So I'm happy to be here. I'm happy to hold space. And I feel like this is just what I'm called to do.
Thank you, Ray. Next we'll have Tamara. Sorry, I don't mean
You
to.
said no, it was fine the first time, Tamara.
Okay.
Got it. Greetings, everyone. I'm Tamara Quia Hunter. I like to say the work found me. I was already working as a therapist, working with women in rehabilitation from chemical dependency. And so I was working with women as a way to reunify them with their children, and also working with them through losses as well. And that's when I started experiencing my losses. So, goodness, 2011, I experienced pregnancy loss. I conceived without any fertility treatments. And then subsequent loss after that through IUI. And sort of like what Ray was saying, I have been telling my doctors for years that I've been in pain and no one listened. I didn't get diagnosed with endometriosis, ovarian cysts, fibroids until I was 39 years old. Right? So this is years of not being listened to. And the provider that I was seeing at the time that I had my losses just wouldn't listen either. I feel like I was definitely medically mismanaged, just continued, but let's just keep trying with fertility treatments and not referring me out to an actual fertility specialist, which I realize now in hindsight, I should not have been going to her, but you don't know what you don't know. So I do this work to also educate, empower, and encourage others who also may have felt alone through this journey, to support them and to just share my experiences in hopes that I'm just mirroring and helping them to be seen. Thank you.
Thank you for sharing. Cassie.
Peace and blessings, everyone. My name is Cassie Mapamed. I'm the CEO and founder of Village Sis Doula LLC. It truly takes a village. It just blesses my heart to see all of you here, to see the representation. I'm a birth doula, a bereavement doula, postpartum doula, and a fertility doula. And my beautiful miracle baby is sleeping right now. I refer to her as Village Baby, but wow. Holding her in my arms, I get emotional because I didn't expect this, sis. I experienced secondary infertility, right? And I didn't expect to be so emotional through the process. I'm glad to have the safe space to have someone who looked like me because it wasn't even discussed in my family. Often in the family, they say, "Oh, we don't have children have problems having babies. If it's meant to be, gotta have it to be." Like all these different things. When are you going to have another baby? Or it's too late for you to have a baby? All these different and also going for treatment too. Sierra was instrumental. She was the one, even though I'm all in this birth work and have a background in science, I called her to make sure that my test was positive. I said, sis, is this really what I think it is? So it truly takes a village of that support. When you're in this work, if you're not in this work, we all need that support. This is a very important topic, especially as it relates to our community. And I'm glad to see more representation and more people speaking and sharing their story. And thank you for allowing me to be here and to hold space for other people. And I am complete. Thank you.
Thank you. All right, we have Khadijah.
Hi, everybody. My name is Kadisha Bonsu, and I am a therapist. I am here because I don't believe that infertility discriminates. I think that anyone can experience it, and I think that that's not said enough. In my own journey of trying to conceive, one of my orientations towards my journey was that I don't presume that it will happen. And when I would tell people that, I got a lot of feedback about that, whether that made it sound like I didn't believe that it could happen, when in reality, I was just trying to level the playing field and note that it is not my assumption that this can happen. And I want to enter the process knowing that, that I want to be open to whatever may happen. I don't want to assume. And I also am here as someone who is a specialist in perinatal mental health and just wanting to support people through the emotional aspects, the mental health aspects of being on a journey of experiencing infertility. I think that I want to be the person that says I believe you. Like so far, when everyone was introducing themselves, there were so many threads of not being believed, not being heard, not being listened to, and I want to be that person that says I believe you, and doesn't leave the conversation up to people who are experiencing it directly, because I believe that it is everybody's conversation to have. The last thing that I would note is that I'm a minister. And so that's important to me because I believe that the church doesn't have enough healthy conversations about the experience of infertility as well. And so I like to bring both of those experiences together when it is relevant in the therapy room with my clients.
Thank you. All right, Kenya.
Hi. My name is Kenya Pridgeon. I've known Sierra for several amazing years. She is my personal friend and also a part of my village when it comes to all things reproductive. And that's actually how we got close. And so on paper, I am a social worker. My bachelor's and master's are both in social work. And I'm also a survivor of miscarriage and a pastor's wife. So I'm a first lady and a believer. And all of those things play a really tangled role in how I view infertility and how I deal with infertility and how I execute. One of the assignments I think that was placed on my life is being transparent about all of the things surrounding, well, pain in general, because I'm a first lady and a believer myself. And one of the things that I love to scream from the rooftops is that believers can experience pain, the pain of loss, the pain of infertility, and that it is very important to understand the science and the biology and the medicine behind what is happening in our bodies and in our minds, and that it is, in fact, not only not true, but not helpful to tell people who are in pain from infertility and reproductive troubles to just pray about it. You can pray, but just praying probably isn't going to help. I got married in 2010 to my husband, who's still a pastor. And in 2011, my very first pregnancy ended in miscarriage. And a female pastor thought she was helping because my husband had never been married and has never had children. And she called and she told me on my flip phone in 2011 that this was a test and that if I prayed hard enough and battled hard enough, that I actually would not be experiencing, as if experiencing my very first miscarriage was a smokescreen. And so I wound up, thankfully, calling my god sister, who is also a believer, but a licensed therapist, to get some help. But everybody doesn't get that. And so it just became one of my missions to be a first lady, a pastor's wife, and a believer and a survivor who can say, this stuff happens and it sucks and it hurts and we don't know why it's happening. And sometimes it's not a sunshiny experience. And I believe that God can handle all of our feelings. And it's okay for some of those feelings to be anger and disappointment and fear and confusion. And so that's kind of what I like to do in the space. And so far, I've had 2 live births, 1 more live birth on the way, and I've experienced 3 miscarriages, a fibroid, and kidney cancer. And much like Mary, when I first started going to doctors and I went to Duke and paid the big bucks, nobody could tell me why. And so I had a live birth and then had a miscarriage and nobody could tell me what was going on. So I like to hold space for those who don't know exactly why, because it's a difficult conversation when you're not sure and you're eating all the things and exercising and praying and trying all the things and having the surgeries, and the doctors can't tell you why. So I'm just excited to be in this space with all of these women who are still here, kind of carrying the banner for those who are not as easily ready to speak about these experiences and share space and let people know what's happening.
Thank you, Kenya. Leslie.
Hey, everybody. Good evening. My name is Leslie Owens, and I'm a perinatal nurse and an IBCLC. And I'm happy to share this space with you all this evening. I think it's beautiful. I think there's still a little bit of a stigma attached, especially in our community, to going through infertility. I did suffer from secondary infertility, like several of you have said, and went through that for about 10 years. And then I kind of identify with being advanced maternal age and still trying to conceive and worrying like I'm running out of time and it's like now or never and not knowing where to go to get the answers. And that can just be so disheartening. I did end up having a miscarriage and then ended up conceiving my twins. They were my double rainbow babies, and they're about to be 3. And I was 40 when I had them. And that was, a huge blessing, but it's been a journey, quite the journey to get to this point. And I just love to be able to hold space for others that have been there and that are there. And, a lot of women that go through infertility, sometimes they end up going through fertility treatments, oftentimes will end up with multiples. And I love to hold space for those women. There's a lot that goes with it. You're blessed and you're happy and everything, but it's hard, very hard work. And sometimes going through it's a guilt associated with well, I shouldn't complain, because, I'm blessed that I was blessed with 2 babies, right? But it can be so hard. So there's so many mixed emotions and feelings that go with that. But I just love to hold space for you all and for other women that have been through it or going through it. And I love to help, especially like advanced maternal age and moms of multiples with breastfeeding.
Thank you. And now we have Dr. Hale.
Hi, I'm Dr. Catherine Hale. So I'm a integrative OBGYN, so trained board certified OBGYN, but also with specialized training in functional medicine. So I enjoy taking an integrative approach. Bestie with Ray, who lives far too far away right now. And we actually were pregnant around the same time, which was a fun journey. But I got married in 2013. We chose to sort of wait a few years before trying, but didn't end up getting pregnant with my son until, 2000. Well, he was born June 2018, so you can do the math on that. So I definitely identify with the stigma around infertility, and Ray will tell you this. It wasn't even something that I would sort of admit, even though the math definitely, confirmed infertility. Wasn't, as an OBGYN who helps so many people get pregnant through conventional and sort of a more of a holistic approach, it was hard for me to admit that that was something that I was struggling with. But one of the things that is sad, that it is true that so many times, especially us, as women of color, we are not heard. Women in general are just not heard, but especially women of color, unfortunately. But so as an OBGYN, that's one of the things that I try to do. I always try to hear, always try to believe, always try to give options. One thing I love with Ray as well, we both enjoy taking alternative approaches to our health as well as to fertility. And one of the things that I do in my own practice now is things like, preconception counseling and, fertility preparation, from a holistic approach. But yeah, definitely a conversation that needs to be had more often. My son is 4 now, preparing to be in kindergarten, which I can't believe. I was 39 when I had him. And even the experience of, I definitely identify with the experience of being advanced maternal age when you're preparing to have a child and all that comes along with that, trying to make sure that you're not railroaded by, the conventional voices surrounding age and pregnancy and risk and so on, but was blessed to have an OBGYN who I knew was going to take an evidence-based approach and be respectful. Dr. Boots Taylor, who unfortunately isn't practicing anymore, but I'm thankful that he was still around when I had my son. But this is definitely a conversation that's needed. And, right now I have a telemedicine practice. So, I'm one of the resources where women can reach out to for support, whether or not you end up, working with me as a patient, but, I'm another voice that you can reach out to for, as a resource. One of the things that I've observed in my own journey, I was one where there was never a clear-cut answer as to why it took a while for me to conceive. But as I've learned more about functional medicine, I've come to realize the impact that stress has on the body, and knowing the impact of stress on us as Black women in particular from a genetic level. There's so many levels in which the trauma impacts our hormones and impacts our fertility, impacts our experience of fertility, our experience of health in general. And that's something that I enjoy exploring with people, because it's such a common theme and it's often not even evaluated, let alone, offering people with options for managing that. So thank you for having me.
Thank you. And our midwife here, Jamela.
Sorry, had to get unmuted. Hi, everybody. So I'm Jamela. I am a certified nurse midwife. I was a doula for 13 or 14 years before I became a midwife. I am also an IBCLC. Was a nurse. I am kind of on the other side of fertility. I did not experience it myself. Knowing more about functional medicine and also the history of racism in our country and how it affects our bodies, I'm less surprised by that. I am one of the people who is often letting patients know that they are experiencing a loss. I'm often the one who is confirming it. I am the one that then says, we need to have a conversation about your next steps. I am the one that people come to discuss their irregular cycles, and they're waiting for me to say, let's put you on birth control, because that's what conventional medicine tells us to do to regulate your cycle. And my first question is always, how would you like to solve this problem? Are you interested in having birth control and a regular bleed, which is not the same thing? Or are you interested in exploring the roots of why you're having this irregular bleeding? And the number of times that I say this to women and they sort of stop and blink at me like, no one has ever asked me that. I also consider it a huge privilege that I practice in a large, this sounds funny because I'm a midwife and you wouldn't think it's a privilege, but I practice in a very large industrialized practice. We have something like 17 collaborative docs that we work with. There are, I think at last count, 16 advanced practice providers, all on my team, but we also are the largest provider to Medicaid recipients, uninsured, refugee population. So these are patients that would never have this type of care because the access to it, there's such a barrier. And I hold that very seriously. My days in clinic are jam-packed because I will not say no. I believe what Ibram Kendi said about one of the ways we can combat or be anti-racist is to be a little discriminatory on our own. And so I will say yes. If a Black patient shows up and they're like, we're running late, yes, I will see them. Like that's just part of my practice. But I am also one of those people who shouts. I was so glad to hear you say this, Dr. Hale, about a lot of the reason why Black women experience such increased rates of infertility is because of the fact that we live in America and it sucks here and it's a racist society, and the amount of weathering that is done. You talk about women who are advanced maternal age. I was telling one of my very favorite patients the other day, the only thing that matters to me is that means you've lived in this country longer. And so that's harder on your body. And so we have to work really hard and pull in absolutely everything we can to support your body in the really important work it's doing. So I am really excited to have been invited to this and get to speak with everyone. Thank you.
Thank you all so much for sharing. And now I'm going to turn it over to Ray to allow her to facilitate. I forgot that I totally didn't even tell you guys what my credentials were, other than the fact that I am the executive director of the organization, but I'm also a certified health coach, and I specialize in fertility. And I'm also an IBCLC. So I see a lot of people that deal with infertility every day. And I wanted to do this work to give back, because when I started going through my own journey, there was nobody out there that looked like me that was able to say, hey, I've been where you are, and let me try to take your hand and walk you through this thing. So that's why I do the work that I do. I'm hoping to one day become like my lovely mentor, Jamela, and be able to help people by actually being able to be the person that can run the test and figure out what's going on with them and help them to find solutions. So let's go ahead and have the conversation, turning it over to Ray.
Thank you so much, Sierra. And I too hope one day to be able to be that person that can say, yes, let's run these tests, let's do this. I'm listening to you and I believe you, because that just means, like, I remember how it felt to have someone say, like, I believe you, like, I believe the pain that you say that you're in. And yeah, I'm willing to do whatever, to help you get to the bottom of this. So But one thing that I did neglect on my own journey was my mental health. And so that's where I would like to start this conversation, is hearing from the mental health professionals. Just talk about like, what is the importance of seeking that support, and how do we encourage people, especially people of color, to see a therapist while they are on the journey, especially when I feel like therapy in general is already stigmatized in our community. Like, how are y'all doing it out there? Like, what are you doing to get people to come see you, and what's the importance? Anybody can take the voice.
Yeah, I would like to start with the stigma part of it. I think one thing that can help people feel more comfortable coming to therapy is to dismantle the idea that something has to be wrong. Just like you go to the doctor for annual physical, there may be many reasons that you see a therapist. Yes, when we're talking about experiencing infertility, there can be things that are wrong, but in terms of like mental health diagnoses, but I don't necessarily see them as a wrong thing. And so I think we have to start by reframing how we approach seeking help, right? Maybe this is a place where I can work on my holistic health so that I can make sure that I am reducing my stress, right? So rather than saying something's wrong with me, I need to see a therapist, I need to see a therapist because I need a place to talk about the traumas that I've experienced, to talk about the stress that I'm undergoing. And ultimately, another major reason is you might be talking to people about it. You might have plenty of people in your family or friends, whomever, right? You might have a confidant that you talk to about it, but sometimes even those people don't really know how to talk to us about it. They may want to be supportive, but we can often wind up feeling invalidated. And I think therapy is a process that can help you with all of those different things, the emotional sides, the stress, the mental health aspects, but also the relational sides of going on your journey, so that you can learn to set boundaries with people about how in terms of how you cope, but also in terms of getting people to rally around you and teach them how to support you. Because at the end of the day, people can say really harmful things even when they're well intentioned, and it's a lot of the times it's because they don't know how to support us. And so sometimes the way that you can help yourself is to create that space for you, for you to be heard, but then to empower yourself to speak up and teach the people around you, hey, this is how I like to be heard, this is what I need. So it's a place of advocacy for yourself, but it's also a place of bridging the gap between yourself and the people that you're closest to, so that you can be supported by your village.
I wanted to chime in on that one too. So I think we can't have the conversation about Black women's health without having the conversation, including Black women's mental health. And oftentimes we have Black Health Week and we don't really see a lot of speakers, right, talking about Black women's health or maternal mental health, Black women's mental health or maternal mental health. And so one way that, to answer your question, Ray, about how are we getting the word out there, one way is what we're doing now, but also I try and partner and talk with doctors, pediatricians, right? Because they're on the first line when birthing people, mothers bring their babies within the first week, right? To have that checkup, really trying to talk with other practitioners about the importance of screening, referring. So that is how I've been trying to get the word out for women and birthing people. I find that, you know, we believe our doctors, right? So if your doctor is saying, a lot of my referrals come from doctors, right? Or doulas. And also when I do speak with women, we talk about the triangle, right? Mind, body, spirit. If one is off, then the triangle is not balanced. And just like Khadijah was saying, you know, we have a doctor for cardiologists, right? You have all these different practitioners for different parts of the body. It's the same thing. It's just like, it's maintenance, right? Continuing that process of just checking in and talking. And so in supporting women who are going through pregnancy loss, infertility, and postpartum depression is part of it, I find that I have quite a few clients who have gone to therapy with therapists who aren't trained, right? And so they'll say they're depressed, oh, it's just nothing's wrong with you, or, just not helpful in that way of not believing what they're saying and thinking something is wrong with them for feeling the way that they feel. And they're like, then I don't want to go back. I didn't want to try therapy again. So that's the part that I want to stress. You see a podiatrist because the podiatrist is trained in that particular field of medicine. I think it's important to see a therapist who is trained in maternal mental health.
Can I piggyback off of that for a second? Because I think that last point that you made is so important, Tamara, about seeing a specialist, right? Even when you were talking about the depression piece of it, it may not be that the therapist doesn't know what they're talking about. It could be that they're not considering the whole picture. They may not take a reproductive assessment when they're doing their mental health history, not just of female identified people, but of however the person identifies, because your reproductive health is a part of your mental health. So I think about, for example, how somebody might see a person with a baby and say, they may come to them and they may think, oh, maybe this person is experiencing postpartum depression. But even that term is a bit flawed, because it's not just about postpartum, it's perinatal depression, it's perinatal mood and anxiety disorders. So for someone, whether it results in a live birth or not, you can still have a perinatal mood and anxiety disorder. But most people don't think about that because they're thinking, no baby, no postpartum depression, no baby, no postpartum anxiety. And so we have to be mindful of how we talk about it, but we also, like Tamara was saying, if you see a specialist, they're going to be more inclined to think about it from a holistic framework and not just think about that being a factor or a variable only if you've had a live birth.
And Kadisha, one thing that I noticed, just kind of carrying on that theme, is people becoming more and more aware of postpartum depression, but I feel like the conversation needs to be further enhanced to include things like postpartum anxiety and anger, particularly for people who struggle to conceive. Because as you can imagine, should you get a live birth, all that surrounded achieving that goal, all the anxieties, all the hopes and dreams, that anxiety, that rage, that anger, but nobody's talking about it. I know that I experienced, postpartum anxiety, postpartum anger, postpartum rage, but I didn't know it was happening until later on. I learned, okay, that's what was going on. And I'm, being a holistic OBGYN, feel like I kind of know a little bit more than the average, but I had no clue until after the fact. And that's something that's so important, because you may be screening for depression, but the person may not be presenting as depressed, and with people struggling to conceive, that anxiety, anger, rage piece is huge.
I'd like to also point out that just when I'm making referrals, I am very cognizant of who I'm referring to, because we have two therapists that see patients in our practice. One looks like the patients I'm referring and one does not. And I think that's important as more research comes out that depression looks different in Black women. The other thing that I am seeing a huge amount of, and it's got to be that you spot it, you got it thing, or you got it, you spot whatever. I have adult ADHD, and it presents very, very differently in Black women, and it puts us at an increased risk for postpartum anxiety and rage because of that, hypersensory thing that goes on. But that is also not well studied in people who are not little white boys. And so I think it's hugely important that we take all of that into consideration and refer accordingly, which is difficult if you have, like in our practice, we have one person, but she knows that a lot of my referrals come from the office that she's not at, but she knows to take them.
I want to add in the personal side of just continuing the conversation of the awareness, to bring the awareness, because I experienced postpartum depression after every single loss. And until my 5th loss, I didn't know what was going on. I just thought and assumed that I had these big feelings, and my suicidal ideations would increase, and it took a conversation with Sierra to be, hey, I'm seeing this pattern. I'm seeing this. There's something going on, and to recognize and say to me, because jumping back on, we're so conditioned that if you don't have a live baby, that we can't be experiencing these things. Our hormones aren't doing well. Of course they are, and it was something that I needed, and my providers were not paying attention to me. They were not listening to they. You can't possibly be experiencing this. They weren't listening, and I was so unaware because we're not having these conversations. We're just conditioned that, yes, this is you don't have a baby. You didn't have a baby, you didn't deliver a baby. You can't possibly be experiencing this. It's something else. And if we're not having these conversations, we can genuinely lose women to something that we can prevent by talking about it more, getting it out there, and understanding. Um, and it's just very real.
Did anybody else have anything they wanted to add there? I wanted to piggyback off of what you were saying, Mary, because I remember after my loss, I almost felt like overlooked by the whole medical system. I wasn't seeing Dr. Hale then, so we're not gonna jump on her. But I remember just feeling just kind of like discarded and overlooked. And it's like, okay, well, like go home and you can try again. And that's it. There was no like follow up. There was no midwife checking in to see how I was doing mentally. And I honestly felt like after my loss, it was worse than the live birth with my hormones. Like I remember sitting in the bathroom bleeding and feeling just like my hormones just took a plummet, and then there was this cloud over my head and these waves of sadness that I had never felt before. And so I feel like there's still so much work that needs to be done when we talk about supporting people who are postpartum without a baby because they get overlooked. And I also, while you were speaking, Mary, I wanted to know if you could tell us a little bit about how yoga can support the body during, if you have infertility, after loss. Like, just tell us a little bit about what yoga can do.
Through my experience, I found yoga, and we are learning more and more about, through science and studies, about how our bodies hold stress and trauma, and particularly in our hip space and our womb space. And so when we're doing all of the things, thank you. When we're doing all of the things of, the herbal support, the mental support, and seeing the therapist, and there's sometimes things just stay stuck. And so through yoga, moving the body, getting into our headspace of getting into our body, because so many times in trauma, and we experience this as Black women, there's so much trauma. There is generational trauma. We're holding generations of gynecological trauma just in our cells and our bodies. And the act of awareness through our breath, through our mind, and connecting these pieces to movement allows that to break up and stir up, and then allows that to release, so we can get further gains with working with mental health professionals and that type of thing. It allows us to connect into our bodies, when a lot of times I feel through trauma, we disassociate from our bodies. We've been in so much pain that the idea of even being in our body and paying attention to our body is too much. And so yoga allows this space that brings in concentration of breath. It brings in safety to create a space where we can feel, we can hold, we can shake, we can scream. And people don't think about that when you think about yoga, like having this emotional outcry. And that's why I work with women with trauma to be able to have that space. Let your body feel. Let's create this space to let's move out this trauma, this anger, this sadness, this longing, whatever feeling is moving through and stuck, let's move it out. So then we can create space for the healing that can come and moving forward.
That's awesome. We had a question from Raquel. Do you offer virtual classes? And she actually does, because we are going to be having a live yoga session on Tuesday nights. It will be broadcasted from the Faithfully Fertile Foundation page, and you guys can go on there and watch Mary as she helps people by holding space for those that have suffered with losses and those that are going through infertility. So if you guys want to be a part of that, tune in to the Faithfully Fertile Foundation page on Instagram at 7 p.m. on Tuesday.
I look forward to seeing you all there and holding space with you.
I'm so excited that y'all are doing that. And like you said, creating space for people to know that it's okay to feel, because I feel like as Black women, we were taught to just be strong and we can make it through anything. And so we can make it through infertility, and we don't have to show any emotions about it. Or, I mean, like, that's how I felt. I remember telling my grandmom about the diagnosis, and she was like, "Oh, well, that's okay, girl. Like, some people just don't have kids. Like, it's okay." And I was like, we just gonna gloss over this? Like, that's what we do? And I don't know about y'all experience, but I feel like creating those safe spaces to feel and heal is so important, especially, if you are surrounded by people who don't know what to say and are constantly saying the wrong thing. This kind of ties into something else that I wanted to talk about, which was like, especially with people who are navigating secondary infertility, is like being surrounded by people who are saying you need to just be grateful for the child that you do have, or you had one, so why don't you just be grateful and stop trying? Like, how do you have any advice that y'all would like to share to people navigating, just those comments from other people?
Well, I was a person that kind of let things ride for a while. I'm really nice most of the time. So I would just kind of play it off for a while. I think for maybe the first 3 or 4 years, I tried to pretend like nothing was happening. So whenever our family members would say something like, "When are you going to give that man another baby?" I would be like, "Well, maybe someday." And then she got to the point where she was about 4 or 5, and the questions started coming in more and more. And we were at church, and people were on their 2nd and 3rd babies, and these older women would come up to me and just say the craziest things, like, "You need to go ahead and give that man a son. Why you keep playing?" And I'm like, okay, it's really taking everything within me to be here right now, because, it's Children's Sunday and I got to watch all these little kids get up here. And I just got my period this morning and I'm trying to hold it together. And so eventually I got to a place where I just had to be honest. I couldn't keep trying to make other people feel better and not share what I was going through. And eventually, I just said what I had to say. So my husband's grandmother, we were sitting at her house one time and we were having some kind of, I want to say it was like a party or something. And somebody was asking why we were thinking about adoption. And she was like, "Why are you going to adopt? Can't you just have your own babies?" And you would think that she wouldn't say this because his grandmother had also dealt with infertility and ended up adopting his mother, but she said this, she's no longer with us. And I remember just looking at her going, well, I've been trying for 5 years and it hasn't been working. So at this point, we're just doing what I feel like we have to do. And everybody kind of just went, and I never had another comment or question or anything from anybody because I started to share my truth. And that was when I really started to become vocal. So I think you don't have to share with everybody if you're not comfortable, but at a certain point, it almost becomes freeing to just say, this is what it is, and you can like it or not, but just take what I have to say. Maybe somebody else has something to say, but that's how I handle things.
I love that, Sierra. I agree that, you know, you may choose to speak up, you may choose not to, but make sure that whichever one you decide, that it's what you want to do, that is for you, right? So part of a thread in what Sierra had said was that I was trying to be nice. I'm a nice person, so I ain't say nothing. And then eventually that bubbles up, right? And so one question that I would ask, like challenge us to ask ourselves is in general, right? But specifically within this, nice at whose expense, right? So yes, I can be nice. I'm a nice person. I can be nice to you, but guess what? I'm a person too. And if I can extend that kindness to you, then I deserve to extend it to myself as well. And then asking yourself, well, what does that look like right now? So, you know, when people always use the flight analogy of putting your own mask on first, right? So what that could look like practically in a conversation where somebody is, you know, saying those comments that Sierra used, all those examples, right? When you're in a moment like that, putting on your own oxygen mask first could look something like, you know what? I need to go to the bathroom real quick. I'll be right back. It might be that you're ready to say something right away. If you're ready to say something, great. You might have to rehearse saying something, right? It may not come naturally to you to be like, I'm going to just speak up and say my mind. You might have to practice what that sounds like and what it feels like in your body. So I would say take a break if you have to, like step away. Or move away from the conversation. I think a good like go-to line that I would say in a moment like that, when I like, if I had to like practice a saying, would be, so when somebody says something like, just be grateful for the child you have. Well, actually, I am really grateful for the child I have. And grief is also real. And I'm grieving the thing that I want. My gratitude is not negated by my grief. Both things are true for me. And if they're quiet, let them be quiet. Like be okay with them not knowing what to say. And I also want to name that sometimes, you know, people make these statements. I try to remember that people have the best of intentions. Doesn't mean that they should have a pass on what they say. Sometimes they need to be taught, but also reminding myself, like, this is a person I love. This is somebody that loves me. So let me be reminded that they're not trying to hurt me, but they do still I need to teach them how to love me. So it may look like me saying, hey, I know you mean well, but that actually really hurts. And I just need you to show up by listening. Like, it's okay if you're quiet. It's okay if you don't know what to say. Right now, all I need from you is to just listen. And I think sometimes when we slow people down like that, that's enough to help them think about the impact of what they've done. And then if all else fails and you don't know what to say, just say ouch, right? Ouch. They're going to be like, why you say ouch? Because it hurt. It hurt.
I needed Khadijah when I was going through that because none of my responses were that eloquent.
And they don't have to be eloquent. That's why I said
So
that.
I know. I'm just saying at the time I did have a therapist, but she really understand what I was experiencing. So those conversations never really came up, right? About having boundaries. One thing I retreated for a long time. By the first loss, I showed up at everybody's baby shower and all of that stuff. And then I would go home and cry and couldn't go to work for like 2-3 days, right? Because now I'm working with women who are also experiencing losses. I just couldn't do it. And then by the second reproductive loss, I just started sharing. I was like, I can't keep doing this to myself. I have to start being honest. No, I can't come to your baby shower. No, a friend of mine, a really good friend, she was like, can you come to the hospital? And I was like, I can't. I just really want to support you. I'll send you some Pampers. I'll do whatever I can. I could send you food, but I can't come because I know what this is going to do to me. And I can't afford to basically get fired because I'm going to continue to miss work. You know what I mean? Right? And the emotional toll. And once I started speaking up and freeing myself, it got better for me. Now, some people were still, you know, very crass, you know, and then depending on how I felt at the time, I would just say, well, you can have it for me. You know, of course, it was like an aunt who was 70, she couldn't have a baby. But, you know, I would just say stuff like that because I just was like, I just need you to back up off of me. But I think it's just, for everybody, it's different. It's like just finding your way, but self-care is the key. I think whatever you need to do to protect yourself and feel safe. So sharing that journey with those who can understand are going to say, I don't know what this is like for you. However, I want to be there for you. I never experienced this before. I don't know what to say. You know, that's helpful. And those people who I felt that could do that, that's who I would share with. And those who I knew they just didn't have the capacity for whatever reason, you know, I had to just set boundaries and distance myself from people. So I just wanted to offer that. And then what I did not share earlier was I did eventually conceive and had a live birth. But even through that, I still was very protective of my pregnancy. I didn't share with many people because I just really, you know, I just could not have those type of conversations when you're fearful of loss again. It was just another example of just being protective until I actually had my live birth, and then I kind of shared with people that I actually had a baby.
I wanted to give anybody else a minute to chime in. If there was anything else anybody wanted to share. I know we're already at time technically, but we can do like 2 more minutes, right? If anybody else has something they wanted to say. I wanted to highlight how like all the disciplines tie together, right? Because social media has portrayed holistic care to be just herbs and that's it. And that's the definition of holistic. But as we can see, when you're going through something like infertility, we talked about the support from having the right medical provider, people like fertility doulas who can be like your BFF and walk with you through it and hold your hand and say like, wait a minute, I don't know about that provider. Let's brainstorm and see if this is it, or I get it. Like, you don't have to explain or sugarcoat with me. Like, I see you, I know what you're going through. We see how having the right mental health support can only support you through the journey and like how it all ties in together. So if our medical providers want to talk for a little bit about why that's important and how you encourage people to take that holistic approach, even if they are seeking treatment, because somehow social media has also portrayed that you can't do both, right? Like it's not important to take the holistic approach if you're going to have fertility treatment. So I want to leave space to talk about that. And then if anybody else wants to share any advice or offer any encouragement, and then we'll wrap up.
Yeah, so a few quick things. Again, preparation for pregnancy, I believe, is important. There's a lot, you know, the holistic approach, again, whole body, mind, body, spirit, you know, doing the work to address the traumas in your body, detoxing mentally, physically, emotionally. That's important in terms of preparing for pregnancy, asking questions, being willing to fire your doctor if you're not getting the answers that you want or the responses that you want. Unfortunately, in conventional OBGYN, you have to have 3 losses before most people do workup. That's not acceptable to me. If it's not acceptable to you, then find somebody who's going to listen and do the workup that you want or need. Again, an integrative approach can mean working with somebody like myself to help to heal your body from the inside out, in preparation potentially for working with somebody for IUI or in preparation for seeing a fertility specialist. You can work with somebody who practices whole body medicine, and you can also consider doing, you know, saving your eggs. You know, one of the things that, you know, we hadn't really talked about is a lot of us as Black women so focused on career and achievement, not really thinking about fertility. until we're in the space where it's like, oh, you know, low ovarian reserve, and what does that mean, and what do I do now? But potentially having those conversations sooner as we're pursuing our goals, like, okay, if I want to have children in the future, what maybe do I need to do now to kind of optimize my chances? And like our lovely midwife, I think Jamila was talking about, doing the different, you know, seeking out the people who are going to access tests. Don't accept just being put on birth control if that's not what you want, you know? So asking the questions, advocating for yourself, as Ray talked about, getting the people on your team that you need. Acupuncture hadn't been mentioned, but acupuncture was a tool that I found very beneficial. Kind of like yoga, it helps with the energetic aspect of whole body health. I even did yoni steaming. So here's a gynecologist who did yoni steaming. I mean, whatever you need to do to move that energy to get yourself in the space, to make your body safe. That's one thing that a lot of people have talked about. A big part of health, overall health, but especially when it comes to preparing to conceive, is creating that space of safety within your body. Because if you think about it, if you're going to be welcoming a child, your body needs to be safe. If your body's not safe, it's not going to happen. You know, that's a very simplistic way of putting it, but so many different themes, when you take a holistic approach, come down to creating that place of safety in your body. So.
Takes me forever to unmute myself. I was just gonna, I mean, I really don't have anything additional. I think Dr. Hill kind of hit all of the pieces of how, I mean, clearly throughout this, you can see how everything really fits together. I do want to, what she was saying about your body has to be a safe place. I have started thinking a lot and connecting us to the fact that, like, we're mammals, you know, from a scientific standpoint, we are mammals. And for millennia, mammals have had the ability to shut down their fertility in times of stress. Your body knows when it's not a great environment, and that may be inside or outside, to bring a child into the world, because it's a huge metabolic demand on the body, both while you're pregnant and then for years afterward. It takes years to get, and there's no back. It takes years to get to a new space. There's no back. Your pelvis is never going to go back to its original shape, nor is your rib cage. Like, nothing is going back. And so I think we need to pay a lot of attention to that. And I also want to say, like, I don't know that we've talked a little bit about preconception care. I like to catch young reproductive people, you know, who are just starting to menstruate, and teaching them about understanding the signals that your body is giving you. Because it's not, and we're telling women this all the time, it's totally normal to have cramping and heavy bleeding, and it's not actually normal to have a long period. It's not normal to have pain. It's not normal to have gigantic clots. It's not normal to have cramps so bad you throw up. Like, that's not normal. And we have to stop teaching people that that is normal, and to accept it when their providers say, oh, that's okay, you can just take ibuprofen. That's not the answer. And so it should start from the beginning. If you're not getting the answers when your menstruation is off, find someone who will help you then, because that would prevent so much of the infertility issues that we're seeing. And then hopefully, as we continue to evolve, and hopefully as we increase our decolonization practices, we will see that, like, we will really start to see the tide turn, because I think that's a huge part of helping this place become safe for our babies.
Yes. I feel like I could just go on a whole other spiel about if a provider would have listened to me at 15 when I was bleeding through pads every 2 hours and not able to focus in school because I was in so much pain, and everybody told me it was normal. Like, what a difference that would have made when I was 22, and now I'm showing up and I'm saying, I'm still having these painful cycles and I can't get pregnant. And this has been going on for all of these years. And the only answer has only been get on birth control, which has then given me hypertension from being on the birth control pills. Now I'm taking a pill for the high blood pressure and I'm on the birth control pill and I'm still in pain. But anyways, we'll have to have part 2 clearly for that, because but I just wanted to say thank you to the providers who are out here doing the work, all of you. I'm honored to share this space and hold space with you. Thank you to everybody for sharing your stories. I am just so grateful to have had this conversation, and I want to pass it off to Sierra so she can close us out, unfortunately. Close us out, but thank you all so much.
Thank you, everybody, for coming and for having this conversation and holding space. I am just so happy that we were able to bring awareness to these issues because, you know, my mom is on here, Brenda Robinson, that's my mom. If you can see her picture, you see she has my face or I have hers. But if she had been able to be on one of these calls when I was 15 and having these problems and nobody was listening and she was trying to take me to the doctor, what could that have done for me? What could that have done for all of you that may have had those periods if your mom had been able to go on YouTube and find a conversation like this and hear that, no, you bleeding like this is not normal. You having these cramps is not normal. So I want to continue to have these conversations. I hope that you all will continue to have these conversations because there are so many young people out there that look like us that are going through this right now, thinking that at the age of 13, at the age of 9, I've even seen children being put on birth control at 8 at this point, who are starting their cycles and doctors are going, well, we don't know what to do. Here's birth control. And these same children turn into adults that are 22, that are 24, that are 26, that now have low ovarian reserve and well, IVF it is. And so we need to be continuing to share and bring awareness because somebody out there can be helped by just listening to this conversation. So thank you all so much. And thank you to the mental health professionals as well for sharing, because when you think about infertility, a lot of people don't understand the mental anguish that comes with it and the roller coaster ride of emotions that you go through in a single month of starting out. Okay, my period's done and now I'm so excited. Yes, we're going to try again. And now I'm ovulating and you got to come home, babe, because we have to do the do. And then you're excited for 2 weeks and then your period starts and now you're depressed for a week and then wash, rinse, and repeat. And so just having people say that, you know, this is a thing, you're actually okay to be feeling these feelings. It's okay that you feel jealous. It's okay that you feel angry, is great for people to hear because they think that something is wrong with them because they're having these feelings. They think that something is wrong with them because they can't muster up the strength to go to another baby shower. And our friends a lot of times feel some type of way because we have to say, no, I can't do it. Or we have to say, well, you know, I kind of have something going on this weekend. And they start to feel like we're trying not to be involved, but it's literally a space where I can barely get myself out of the bed in the morning and I just can't do it. So having that conversation, I think is also very valuable. And then for the stories that were shared, just being a person going through infertility or trying to conceive, period, and knowing that there are people out there that look like you, that have been where you are, is so valuable. So thank you so much to everyone. I hope that next year we'll be able to have more conversations and that maybe we can do a part 2. We keep saying that every year, but we never do. So thank you all again so much. I hope that you all will tune in on Tuesday and check out our yoga session. And we hope to see you again next year. Keep spreading the word and please share the video. Thanks again, everybody. Bye.